So I'm with Senior Provisions. We are a family-owned, faith-based placement company. So what that means is we help families find the best fit for their care needs. So if you need in-home care, assisted living, memory care, even independent living, then I help you find that best fit for you or your family members to make sure that you're going to have great care and that you're going to feel good about it. So there are a lot of options that are out there, and I've been in the senior industry for a long time. So my background is counseling. I used to do in-home counseling with seniors who were homebound. And then I've been over a memory care program for a few years. I even sold insurance for just a minute. I absolutely hated it, but I learned a lot about Medicare, which everybody has questions about Medicare, right? So I can answer those questions as well. I've been a salesperson in a community, and I've also done VA benefits for a long time. So kind of have a well-rounded knowledge about anything senior. So if you have questions about any of that, let me know. I'm happy to help you. So this is our team right here. I'm the only one here in the Nashville area, but we find true solutions for our folks and true transitions. So we've built a network of providers to make sure that you have some great options for your care. And we've been in business for 15 years. And so everyone on our team has a background in senior living. So what is normal aging versus dementia? There are 10 warning signs and keys to good brain health. Just before I get started, any ideas of what's normal versus dementia that you need to be concerned about? Anybody want to guess? So dementia, just to explain really quick what that is, it's a cluster of symptoms that you experience, such as forgetfulness, hallucinations. You can have some behaviors along with that. And so there's a whole list of symptoms. But dementia is like a big umbrella. You know, cancer, when someone has cancer, what's the first question you ask? What kind? Exactly. Dementia is the same way. So there are over 100 types of dementia. A lot of people don't know that. Now, the most common form of dementia is Alzheimer's. 70% of people who have dementia have the Alzheimer's type. But then you also have vascular dementia. So anyone that may have had a stroke, they didn't have dementia before, but they have had a stroke and then they have dementia after. That's part of vascular dementia. There's Lewy body, there's Parkinsonian dementia. There is Korsakoff syndrome, which has to do with the alcoholism. So there's a lot of other different kinds. Okay, so normal brain aging. So it's common to experience some issues with normal brain aging, like forgetting something and then being able to recall it later, like you said. How many people walk into a room looking for something and when you get there you forget what you're looking for? Same here, okay? Or you're thinking of words and you can't remember what the word is, and after 5 minutes or a day even, you remember what that word is, right? Yeah, okay. Part of that's normal aging, right? So changes that interfere with daily life and your daily activities, that's when it's a concern that it could be something more serious like dementia. So if you're more disheveled, like if you're not taking a shower on a regular basis, you're forgetting to brush your teeth, you're having financial trouble, you start buying things that you don't need to buy, or I had someone before that they started just giving money, all the look, I can't even remember my word. Scams, yes, thank you. Giving money to all of that. Those are areas of concern. So dementia is the umbrella term, like I said. that for a person's decline in memory or other cognitive abilities that are severe enough to interfere with your daily activities. It's not a normal part of aging. So the most common form, like I said, is Alzheimer's disease, and it's progressive. Most dementias are progressive, and what that means is it's only going to get worse, okay? And there's no cure at this time. So top 10 warning signs. So memory loss that disrupts your daily life. So one of the most common signs of Alzheimer's disease or dementia, especially in the early stages, is forgetting recently learned information. So with Alzheimer's, it starts in our hippocampus, right? That's like in the middle. And basically that's the road where our short-term memory, where our brain takes our short-term memory to the long-term memory. So we start there. What happens is there are roadblocks, right? The cells start to die in the hippocampus, and this is with Alzheimer's disease. And so then we hit those roadblocks, and then that short-term memory is no longer able to get to the long-term memory. And so that's what happens is we're not able to recall the things that we recently learned. Other things are forgetting important dates and events, asking questions repeatedly, the same questions over and over again, increasingly needing to rely on memory aids, so notes, electronic devices, things like that, or family members for things the person used to handle on their own. So when a family member has to take over the finances. What's a typical age-related change? Well, sometimes forgetting names or appointments, but remembering them later. Okay? Challenges in planning or solving problems. Some people living with dementia may experience changes with their ability to develop and follow a plan or work numbers. So like someone who has always been good with your finances, someone who has always been good with math and accounting, and then they get them jumbled up and they're no longer able to keep their checkbook. Young folks today don't know what a checkbook is, right? I still use mine. I don't know about y'all, but I do. Someone needs to take over their bills. They may have difficulty concentrating and take much longer to do things than they did before. So if it's taking longer to take a shower or getting dressed, not because of physical, but just because you're not able to maneuver the buttons anymore because you don't know exactly how it works. So typical age-related change is making occasional errors when managing finances or household bills, but not on a regular basis. Any questions so far? Like I said, please stop me if you have questions or a comment. All right, difficulty completing familiar tasks. So people living with dementia also find it hard to complete routine tasks, things that they've done on a regular basis all along. So sometimes they may have trouble driving to familiar locations. You know, if someone gets lost driving, or they get in a car and they're like, I don't know exactly what to do. Let's see, organizing a grocery list or remembering the rules of a favorite game. If you start to notice any of these little things, you know, is something to be concerned about, whether it's with yourself, a friend, or a family member. Let's see. Okay, so typical age-related changes that you might see. So occasionally needing help with the new apps and settings on your phone, or help trying to record a TV show. Now, if you just need occasional help, but then it's okay, then you're fine. Confusion with time or place. So people living with dementia can lose track of dates, seasons, and passage of time. They may have trouble understanding something if it's not happening immediately. Sometimes they may forget where they are, how they got there. Sometimes, though, like, have you ever been driving and you're just deep in thought, and then you're like, oh, how did I get here already, right? That's just because we're deep in thought. That is not dementia related. That is just being, you know, in your head, right? But you're still paying, how is that? How does that work though? You're still paying attention to where you're going. You're still driving good, but yet it's like, how did I get here? So a typical age-related change, getting confused about the day of the week, but figuring it out later. How many times do you, like last week, it was this way with me. How many times do you feel like, oh, this feels like Friday and it's Wednesday all day, right? We all do that. Well, that's normal. All right, trouble understanding visual images and spatial relationships. So for some people, vision problems are a sign of dementia. This may lead to a difficulty with balance and trouble reading. They may also have problems judging distance and determining color or contrast, causing issues with driving. Another thing too, have you noticed sometimes do you have trouble going from when the floor changes, like from this floor here to maybe a carpet? There are depth perception problems as well that happens. So if you see someone shuffling, sometimes that's physical, but sometimes it's because their depth perception and they can't see very well. So they're not sure what they're doing. They're trying to be safe, which when you're shuffling, it's not safe anyway, right? But they don't realize that. So that's important when you start to notice changes like that. So a typical age-related change is your vision changes related to maybe cataracts. A lot of people also have macular degeneration as well. All right, new problems with words and speaking or writing. So people living with dementia may have trouble following or joining a conversation. They may not be able to participate like they used to. So they might stop in the middle of a conversation, may not understand what you're saying or how they can respond. If you start noticing things, they may repeat themselves. They may struggle with vocabulary or having trouble naming familiar objects or use the wrong name. So we all know this is a pointer, right? So they might say, oh, that thingy, or try to make up words. Yes, yeah, I use thingy and whatchamacallit, and I tell my husband, you know what I'm talking about, right? And he doesn't. But so what's a typical age-related change is sometimes having trouble finding the right word. I do that a lot. I think that's just because I'm overwhelmed and have a lot going on up here and not enough room, right? I don't know. And maybe tired. I don't get enough sleep. So I'm a musician. I stay up late at night and then now going, having hot flashes and all that stuff. Y'all know how that is, right? Okay. Misplacing things and losing the ability to retrace it. Now, my husband loses his keys every single day. And I tell him, if you put them back where they go when you're done, when you walk in the house, then you wouldn't lose them. Mine go in the same place every day, but his do not. But he can find them. He can retrace his steps and he can find them, usually with my help, but because wives, we always do that, right? We're the ones that have to find everything. So a person living with dementia may put things in an unusual place though, maybe in the refrigerator, or put dentures, right? Or put dentures in a napkin. A lot of times what happens at senior living communities, the dentures are lost because they get wrapped up in a napkin and they get thrown away. So it's important to make sure that the napkins are always checked. So things like that. They may lose things and be unable to go back to retrace their steps. Or they may accuse other people of stealing. That's actually a normal thing that happens, or a common thing that happens with folks with dementia is they start to accuse others of stealing things. So what's a typical age-related change is misplacing things from time to time, but being able to retrace your steps and find them. Decrease or poor judgment. So individuals may experience changes in judgment or decision-making. For example, they may use poor judgment when dealing with money or pay less attention to grooming or keeping themselves clean. So they might be a little disheveled, not shaven, their hair not combed, wearing the same clothes over and over again, their clothes being sold. Typical age-related change, though, making a bad decision or mistake occasionally, like neglecting to change the oil in the car. Now, if you're doing that on a regular basis, that is not good. But, every once in a while, if you're a little late on the oil, maybe. But another example of poor judgment is, it's 80 degrees outside? If you come in a coat, right? That's poor judgment, because then you can get really hot and maybe have a heat stroke. Or if it's really cold outside and you're dressed for the summer. Withdrawal from work or social activities. So if you see a change in them not wanting to work, or they're kind of becoming into themselves and isolating themselves, or not wanting to come to the senior center, not being social anymore. You guys have the best, I have to say, the best senior center, because you have so many people. Yes, absolutely. So you have so many people here that participate in the activities, all of you guys, and you care about each other. Because y'all know me as Proud Mary, right? If you're coming to bingo, then you see me as Proud Mary. So, but you have a lot of people, you genuinely care about each other. But not only that, you have an absolutely wonderful staff here. Yes, so you do. You have people that are looking out for you. And so that's what it takes, is people looking out for each other. So when you start to notice someone falling back, always ask why. What's going on? Is something going on? Have those conversations. They may or may not be able to tell you. If it's a physical thing, that's one thing, you understand. If it's more of a cognitive, that they're isolating because they're not able to engage in activities, they're not able to have conversations, they're not following the conversations, and they just feel kind of lost or look lost. Start having those conversations. If you feel uncomfortable having that conversation, talk to Laura, and then she can check in with them. So a typical age-related change is sometimes feeling uninterested in family or social obligations. Sometimes you may just not feel like going, right? You might not feel like, when it's 100 degrees outside, who wants to go outside on a picnic, right? Things like that. Changes in mood and personality. Individuals living with dementia may experience mood or personality changes, and we probably have all seen it where somebody's just a little more frustrated. They snap at you pretty quickly. And yes, so some of these mood and behavior changes might be due to some dementia starting. They can become confused, suspicious, depressed, fearful, or anxious. Might get easily upset at home with friends, or when they're out of their comfort zone. So a typical age-related change is developing very specific ways of doing things and becoming irritable when a routine is disruptive, or like if you're set in your ways. I've had several families who they've seen that negative change, where they started having just a lot of trouble being agitated, and families are like, oh, they've never been this way. They've always been so sweet. But I've also had the opposite, where I had a family member come in and we're like, oh, we just love your mom. And they were like, my mom? Are you sure? Yeah, she's so sweet. My mom? Are you sure? Like, she's never been sweet one day in her life. I'm like, she is now, so, be happy. Okay, so you see these changes, and, some things, though, it kind of depends. Like when someone just starts to change, quickly have the mood changes, and quickly are irritable, and you see changes, the first thing we do, though, is check for a UTI. As you get older, if you have a UTI, then that can cause some of these changes. So you get that taken care of first. Now, if these continue, then unfortunately, it's probably the development of something. Okay, what to do if you notice a sign. This is important for everybody. And this is whether it's for yourself, if you notice a change with yourself, or with a family member or a friend. So if you notice one or more signs in yourself or another person, it can be difficult to know what to do. And conversations are hard. And if you're not comfortable with those conversations, then talk to someone else to help you with that conversation too. It's natural to feel uncertain and nervous about discussing these changes. Voicing worries about your own health might make them seem more real. Or you may fear upsetting someone when you share those observations. However, these are significant health concerns that should be evaluated by a doctor. So if you're concerned, if you don't say something, find someone else that might be a little more comfortable about saying something, and make sure that they're seen by a doctor. And it's important to take action to figure out what's going on, because it could be easily fixed, like a medication change. It could be a UTI. It could be something else. It could be emotional change, like maybe something happened in their family, maybe an argument with someone that has them upset. But it's important to make sure that you have those conversations so that you can figure out what's going on. Now, prevention and brain health. Early detection is important, because if there is anything that you can do. One thing I want to say before I move on to that, another thing too is hearing loss. There have been a lot of studies that have been conducted that correlate hearing loss with dementia. A lot of times, if you catch it early, so early detection, if you catch it that it's the hearing loss, then chances are you might be able to prevent dementia if you're able to address the hearing loss issue. So keep that in mind too. But early detection is very important, because that way, if you need any medications to help you, I'm not a huge fan of medications. I only take them when I have to, but in some cases, medications are very important and very much needed. So it just depends on the situation. But early detection and trying to make sure that you have things in place, that you have a power of attorney, you have your wills done before you get to the point where you can't sign anything, okay? So make sure that you have all of the legal stuff in place. That's very important. All right, exercise. So it's really important to exercise at least 3 times a day. How many of you actually, not a day, sorry, a week. I'm sorry. Thank you. Thank you though, I appreciate it. No, don't apologize, because you called me out, I was wrong. So 3 times a week, okay? How many of you do that? I don't. Y'all are awesome. Y'all all get an award for that, because I don't. My exercise is walking in and out of buildings and stuff. That's what I do. Yeah. So I think you and I are kindred spirits, maybe. Yeah. Okay, proper nutrition. That's not me either. I don't know about y'all, but no, it's really important to make sure you're getting proper nutrition. Fruits, vegetables, protein, all of that's very, very important. Staying hydrated, I've already talked about that a little bit. Sleep and naps. Oh my goodness, to have a nap, whew, I would love that. Making sure that you have plenty of sleep at night. I don't get plenty of sleep, but I need to. But that's really important as well. And then learning new things. So let me talk about that. You're here, you have all kinds of classes throughout the day, so it's important to make your brain work and to exercise your brain, not just your body. So learning new things is a great way to keep your brain exercising. So learn a musical instrument, learn a language, learn how to play a game. Basically exercise your brain, your body, eat right, and stay hydrated. All things that can help you prevent it. And yes, sleep, yes. All right, which you get, but I don't. So having a conversation, like I've said over and over and over again, it's important to make sure you have conversations. So if you notice any of these signs in yourself, talk to your doctor, talk to Laura. She can get you resources, right? Confide in someone that you trust. If you see this in someone else, then talk to that person if you feel comfortable enough. If you don't, talk to Laura, right? So she can help with all of that. So think about who would be the best person to approach, whether you or another trusted family member or friend. Have the conversation as soon as possible, in a location that will be comfortable and not threatening. Okay? Because when you start to have these conversations, you don't know exactly how the other person is going to react. So you want to make sure that it's a comfortable environment and that you go and approach them in a loving way. See a doctor and get a baseline. If you're seeing your doctor on a regular basis anyway, they're already going to have a baseline of you, but they can do what's called a mini mental status exam. And that's important too. If even now, as you're getting older, just go ahead and ask your doctor, can you go ahead and do a mini mental status exam on me? That way you have my baseline. So if anything starts to change, then we'll be able to do another one, and then you can see if there are any changes that are going on and if we need to address them. Okay, and so it's good to have that done every 6 months to a year. If you don't have any trouble, every year, once a year is fine. But make sure that if there are any cognitive changes, that it's being addressed. But it's obtain a full medical evaluation to determine any symptoms. If the cause is not Alzheimer's or another dementia, it could be a treatable condition. Okay? So if it is dementia, there are many benefits to receiving an early and accurate diagnosis, which include the opportunity to plan for the future, like I said, finding a person that you trust to be your power of attorney, getting all your financial and everything together, all your finances and everything together of what's going to happen when you get to the point that you can't handle anything. So make sure that you're planning for the future. Access support services and explore medication that may address some of the symptoms. Like I said, I'm not necessarily a huge fan of the medications, but sometimes they do help. And we're almost done. So find a trusted advisor. Make sure you find someone that you trust that's going to be able to help you once you start getting everything together. Make sure that you prepare legally and financially. So it's important, no matter who you are or what your situation is, even if you have children, it's important that you all have a power of attorney. And it is important to make sure that you see an attorney for that. And make sure that your children know, or your friend or family, whoever is that person for you, make sure they know what your wishes are. Because that is super important. My mom told me several times before she passed away what her wishes were. And that way I was able to follow them through. So I didn't have to, when it came time for her funeral, I didn't have to worry about it. I knew exactly what to do. Create a plan. So that's important. Make sure that you're planning ahead and connect with others. So communication, that's a key. Doing self-evaluation. Making sure that you know kind of how you are, what your own baseline is, but then also making sure that you're exercising not just your body, but your brain. You're having great nutrition with fruits, vegetables, protein, all of that. And then hydration. You know, drink plenty of water and fluids. Getting good sleep. If you're not sleeping well, talk to your doctor about what you can do, because everybody's different with the reasons that they can't sleep. It could be because you're having pain. It could be because, I don't know, going through menopause. It could be hydration. It could be anything. It could be because you have a dog barking outside, you know, whatever. But make sure that you're talking about that and that you're seeking the resources that are out there. Any questions? Thank you.